in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road
It's a shooting of a male currently being shot in the head.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, okay, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear? Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we're going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight,
Where's it hurting you the most, buddy? Okay.
a builder is critically injured after falling onto concrete.
Yeah, that's it. Relax now.
Can you see the asymmetry on his tummy, kind of, and around and back?
An employee is stabbed in an argument at work.
How big was the knife?
Ambulance service, is the patient breathing?
No, the patient's not breathing. I've been run over.
A 6-year-old boy runs into the road and is hit by a car.
Hello? Hello? I need you to talk to me, please.
Do you want to go on the gas and air for a minute?
And a motorcyclist comes off his bike and suffers serious injuries.
Lucas and everything else is on board.
Lucas is indeed on board.
It's 7 a.m. at Cosford Airfield near Wolverhampton, one of 3 air bases used by the Midlands Air Ambulance.
Battery's fine. I've checked the Zoll. It's literally down by 1 bar, but I think that should be okay.
Critical care paramedic Alistair McNeil and Dr. Ali Hussain are checking their medical kit. For the next 12 hours, they'll be on call for any time-critical emergencies across the region. They need to be prepared for every eventuality.
I think we're good, mate.
Cool. Hopefully the world will behave itself and would...
Yeah, if everyone will stay in bed a bit longer and maybe we'll get to have breakfast.
Well, here's to hoping.
Hello, ambulance service. Is the patient breathing?
Yes.
Are they awake? Are they conscious?
I don't know. It's my husband. He's just said he needs help. I don't
Okay,
know.
are they awake? Are they conscious?
Yeah, he was. I've
And
lost him now.
What's the
Off
reason for the
phone.
call?
He's fell through a floor. He's on an old farm and he's on his own.
Okay, what's the address of the emergency?
All I've got is like a derelict farm.
What's his name?
Neil,
And how old's Neil?
63.
Leave it with me, and I will try and ring him, and I'll find out where he is. We've got the help arranged.
With reports of a serious accident in a remote rural location, Helimed 03 is scrambled.
A 3-year-old male, he's had a fall from height of approximately 12 feet. Injury to the head and back appears to be quite a lot. Is that received?
Oh, yes, that's affirmative.
The patient could have wide-ranging injuries, anything from a serious head wound to spinal or internal damage. All common conditions associated with even a shortfall from height.
So we're looking for a farm. Fairly isolated farm, isn't it? Yeah.
Fortunately, the site is less than 2 minutes flight from base.
So I would say this one, according to the map. What do you think? Okay, blue container, somebody in the field. Yeah. Yep.
A man spotted propped up against a metal container confirms the team's in the right place.
We'll go to the brown field to start with.
Yeah.
Hop over the hedge. Everybody happy with that?
I'm happy with that.
It's going to be quite dusty.
An adjacent field provides the perfect landing spot.
Just watch your feet when you go out. There's a lot of ruts.
Okay.
Within moments of landing, Alistair and Ali reach the patient, who is with a passerby.
Hi, folks.
All right, guys. Came across you.
All right.
I was walking the dog.
Hi, Neil.
Okay.
53-year-old Joyner Neal was carrying out a survey on the first floor of a derelict building when rotten floorboards gave way and he fell 12 feet onto concrete.
You got any medical problems, Neil? No. On any medications? Asthma. Okay, good lad. Where's it hurting you the most, buddy? Okay. So you managed to walk up to this place? All right.
Neal was just able to get himself out of the building before collapsing. He has a cut to the back of his head and pain across his upper body.
Right, okay. Big breath in for me. Where's that hurting? This side on the chest?
Yeah.
Okay. In the middle? In the middle? Any pain in the belly? Good lad. Any pain in the hip area? Legs feel all right?
Yeah.
We'll have a look at your back, all right?
Dr. Ali wants to pinpoint exactly where Neal's injuries are.
I might have to cut some of your clothing. I appreciate you're a little bit chilly, chap, but I just need to have a look at what's going on with arms and so on. So,
Right, do you think you could sit forward for us a second? Right, but I'm just going to feel my way down. Pain here? Pain here?
It's too lumps.
Yeah, it's got a lump on the left side, thinking posterior rib.
The worst pain is in the left side of Neal's chest. A visible indentation on his back points to a broken rib, which could have punctured a lung or be causing internal bleeding.
So if you take a big breath for me, is that stopping you? Difficult to breathe in? Okay, well, it's a possible chest pathology.
He needs urgent hospital treatment.
Primary bag checked?
checked.
Yeah, everything. Ultrasound in the bag and off charge?
It is.
Yeah. Secondary bag check?
Yep.
In Birmingham, Dr. Michael Bright and his team are getting ready to start their shift.
If need be, we'll go get blood and a coffee, because God knows I need a coffee.
In the car today is critical care paramedic Adam Young.
We are part of the care team today, so we go to patients and help the ambulance service out and deliver care that's normally beyond the scope of a normal paramedic.
Paramedic Ed Hurd usually works for the West Midlands Ambulance Service. In his time off, he volunteers with CARE, an emergency accident and resuscitation team based in Birmingham.
So today I got drafted in short notice to go and help the team on my day off. It's quite nice because it offers different experiences for which you don't necessarily see on the road as an everyday paramedic.
Hello, ambulance service, can I help you? Westmeath Police, can we have your assistant? What's the reason for the call? Male's been stabbed in his neck and chest. You can hear another male arguing in the background. He's bleeding.
Okay, is the one who stabbed him still in the area?
Yeah, the offender's still there.
So it's not known if he's still got the weapon?
Got no idea what weapon was used.
Okay, that's fine then. So that's all gone through.
With time of the essence, multiple emergency services are already en route, including the police, as the aggressor is still at large. Critical care backup has also been requested, so Dr. Michael and his team are immediately dispatched.
So we're en route to reports of a gentleman who's been stabbed in the neck and in the thorax. So stab injuries from the chest can be anywhere from completely physiologically normal to traumatic cardiac arrest, requiring quite significant enhanced intervention. It's a spectrum, and we never really know until we get there what the situation is.
Do we have any idea if it's safe to head to sea?
Last year, West Midlands Police recorded its highest ever number of stabbings, up 41% on the previous year.
Just ignore it. I think that it's still there. Once with that in mind, we just make sure the crew hang back and I'll get an RVP when we get there.
The attacker has been reported as being still at the scene, so the team must wait at a rendezvous point.
Hello. I was going to pull up in front, mate, right, so I'm not blocking the road.
Dr. Michael and the crew will be held here until they get the all clear from police that it's safe to proceed.
To immediately test the crew have come across the patient who's been chucked out of the van.
somebody else checked with them because we haven't done it.
There are more than 30 critical care paramedics working on the West Midlands enhanced care platforms.
He's dirt sick, bleeding. I need him out quickly.
You've had a full cardiac arrest. They have brought you back to life.
Following a rigorous selection process, the successful candidates undergo 2 years extra training in all aspects of pre-hospital emergency care. From manning the control desk,
I've got one male, he's early 20s, with a head wound,
to the administration of additional drugs.
Ketamine is going in now.
Okay, you've had 20 of morphine.
Once qualified, they can work across a range of enhanced care settings, bringing life-saving critical care to where it's most needed. Paramedic Tom Hillage is hoping he will make the grade and become part of the critical care team. Today, he's carrying out his first shift in an observational role, under the guidance of critical care paramedic Kerry Hemus.
So if we get there after a crew, you don't really need to take the green bag with you. And then you've got a bit more kit. So you've got your IO, first aid kit, a couple of the SAM splints. Have you seen those before?
Yeah. I've been a paramedic now for 5.5 years, working predominantly out of Shrewsbury. So in April, I was lucky enough to get recruited to become a trainee critical care paramedic with West Midlands Ambulance Service and Midlands Air Ambulance. So this is my first sort of insight into working on the critical care car.
Before Tom became a paramedic, he was in the military, serving in Afghanistan, working alongside the medical teams.
For me, I enjoy trauma. I enjoy sort of learning more and developing myself and pushing myself. It's just that step up from being a paramedic to that next step of being a critical care paramedic.
I'll go through the drugs badge with you, just in case we need anything. The most common one we use really is ketamine and Madaz.
The critical care team carries specialised life-saving drugs, which Tom needs to familiarise himself with. But until he has completed appropriate academic and practical training, he isn't authorised to administer them.
And we've got 2 ketamine in there, benzo, so you just flick it off, needle in, draw it up into a 20ml syringe. He's obviously a very good paramedic to have passed selection, so I'm confident that if we have anything challenging that he's going to be able to assist.
Ambulance service, is the patient breathing?
No, the patient's not breathing. Heart's been run over.
Okay, what's the full address of the emergency?
It's outside Burntree Primary School in Tividale.
Thank you. And how old is the patient?
I don't know, he's only a young child. How old is he? He's 6.
Thank you. I need to get some information and I'm going to help him until we get there. Hello? Hello? I need you to talk to me, please.
An ambulance is already en route to the scene, but with reports of a child not breathing.
Cardiac arrest?
Don't say it.
Oh.
The advanced life-saving skills of the critical care team will be needed, so Kerry and Tom are immediately dispatched.
Yeah, I think we got it. We're only about 2 minutes left.
Resuscitating a child who is in cardiac arrest can be traumatic for even experienced paramedics.
IGL 2.5 should be 26 kilograms is rough weight.
Tom immediately checks drug doses. These must be measured precisely according to the child's age and weight. Administering the correct dose is crucial.
But if it is a cardiac arrest, so if you want to chuck your hood on for me, and you're level 3, then and then hopefully there'll be a truck there.
As they're managing airways, the team has to use the appropriate level of PPE to carry out the resuscitation. Kerry knows that with such a serious incident involving a child, every second counts.
Can't go anywhere, can they? That's the problem.
This curb's horrible as well, isn't it?
In Birmingham, Dr. Michael Bright and his team are being held at a rendezvous point. A man has been stabbed, and they are waiting for an update from the scene to confirm that it's safe to proceed.
Patient is breathing and talking, so ask the crew to come to location.
Okay.
Okay, so I've yet sent with that to receive many thanks. Full safety, do you receive last, do we?
Dr. Michael and his team are directed to where the stabbing took place.
He's here, mate. Oh, that's all right. Oh, defender.
As they arrive, the suspected attacker has been caught and is now in the back of a police car. The patient is being treated on the back of the ambulance.
Hey guys. Hey mate, you alright? So, this gent's got a puncture wound to his left side of his abdomen.
Yeah.
He's just got a hematoma developing, that's all.
Okay.
Do you want to just have a quick look? It's not very evident when he's...
gown, guys, so an apron and everything.
The man was at work when he was attacked.
It literally just looks like a pinpoint puncture, but there's quite a lump developing. Just sit up for us.
Knife wounds look small, but penetrate deeply. A bruise is forming around the point of entry, and there is some bleeding visible beneath the skin.
Can you see the asymmetry?
Oh yeah. Oh yeah.
And it's quite tender on his tummy, kind of, and around and back.
Yeah.
Pops are normal, he's grand. What do you think, happy for the crew to convey?
How far are we from QE?
Despite his injury, the man has a strong pulse and good blood circulation and appears stable, but he needs to go to a major trauma centre for an urgent scan.
We could convey just in case it gets a little bit worse.
If the blade has penetrated the cavity that houses the liver, stomach and intestines, he could be bleeding into his abdomen. This can be life-threatening.
No pain in your tummy particularly. It's just over that site there. If I have a little feel here.
Dr. Michael checks for any obvious signs of internal bleeding, like a rigid stomach.
How big was the knife? 5 centimetres. I don't know if it's knife. She's stable. Although the heart rate's now at 102. I think. What was it initially, guys?
In the 90 was the lowest that I've seen it.
The patient's heart rate and breathing are stable, but Michael and Adam will travel with him to hospital should his condition suddenly deteriorate.
Yeah. Do you want to grab some access just to be safe? So hot.
You guys crack on. Do you want to take blood with? And I'll jump in the front and take some blood with just in case. Adam's going to go and I'll jump in the front. We'll just take the blood with us. And the hematoma is expanding a little bit.
The critical care team carry supplies of blood. Should it be needed, they will be able to give him an emergency blood transfusion en route. It's 20 minutes to the Queen Elizabeth Major Trauma Centre in Birmingham. Adam keeps a close eye on the patient's blood pressure and heart rate throughout the journey.
Is it still bleeding at all, mate? Stop, does it?
How's that pain now? Yeah, it's better. Better than it was. What would you score it now out of 10? 5.
Just under an hour after the 999 call came in, the team arrive at the major trauma hospital, where they hand their patient over to the waiting team for urgent scans.
Any kind of stabbing can potentially be quite significant and can be potentially life-threatening, but in this case it's probably quite a positive outcome and he's probably not going to be critically unwell.
Sorry, just have a look at this head of yours. Any pain down the neck? Okay, just turn your head for me. To the left. Good lad. All right, and then to the right.
In the Staffordshire countryside, Alistair and Dr. Ali are treating 53-year-old Neil, who fell 12 foot from the first floor of a derelict farm building.
Any pins and needles in the arms and legs? Okay, good lad. Yeah, all on that left side again.
Neil's experiencing intense pain in his upper body. Dr. Ali thinks he's fractured at least one rib and possibly other bones in his back.
I'm going to stick a little needle in you, chap, and we'll see if we can sort some pain relief out for you.
Alistair is preparing to insert a cannula in his arm so analgesic drugs can be given intravenously and provide the pain relief Neil badly needs.
Are you using all of this arm to support you? Is there any chance I can take the weight off that arm? Just look at popping a little needle in here. You need to put the arm there and tell me. And you're working here on your own? Yeah.
Hey, buddy, just whilst we're trying to get a line in, yeah? Just have a quick look at your chest, all right? Might be a bit sore, just bear with me.
Sharp scratching your hand, chap, sorry.
Dr. Ali uses an ultrasound monitor to look for signs of a collapsed lung or pneumothorax, a life-threatening condition that can be caused by a broken rib puncturing the lung wall.
Take a big breath in for me, buddy. That's fine, well done.
The ultrasound finds no evidence Neil's lung is currently compromised, but it could still happen at any moment.
Hi guys, you all right?
Ali updates an ambulance crew who've just arrived.
So we've fallen from the first floor inside. He's basically got landed what looks like on the left back and head, not knocked unconscious. He's managed to come and find his way out here. The main pain he's complaining about is left chest, shoulder and back. And looking at it, you can see it looks like some sort of indentation. He says he feels a bit sort of like tight in breathing, but we've done a quick ultrasound, can't see any pneumothorax, so I think it just looks like ribs and maybe back for now. He has got a head injury.
The nearest major trauma centre is 20 miles away. And with Neil's injuries, it's quicker to fly the patient than transport him by road.
Oh, please, yeah.
It's penetrated a little bit, it's like the heel at the back. Can't see any conflict or anything like that.
While the ambulance crew dress Neil's head wound,
It's going to sting you just slightly, okay? But we're just going to cover it up.
03, quick update for this gent then is...
Alistair calls the trauma desk to let them know the plan.
He's fallen probably 12 feet unwitnessed, got a deformity to left rear of back, plus and minus a shoulder injury and a laceration on the head. With a chest wall deformity, we're thinking up to Stoke and we'll probably fly him over.
Roger, that's received. Thanks for taking that.
No worries, it's going to take us a few minutes to get pain relief sorted before we can move across into heli and so on. So as soon as we're sort of loaded in heli, we'll give you a proper shout over.
All right, buddy, painkiller's coming up.
Dr. Ali administers morphine to get Neil's pain under control before they attempt to move him.
All right, here, Neil, just going to give you some of the good stuff. How are you feeling now, a bit woozy? In your legs, all right, buddy, don't worry about that. I can't give you any more now because you're sat up. I don't want you to fall over. Just as soon as we get you lifted. Feeling any better? Yeah, good.
Neil is now ready to be taken to the helicopter.
There's going to be an issue of lying flat on here with the back pain.
Yeah.
It's not going to be straightforward.
He's been like this the whole time.
Okay.
I'm just thinking.
All
Let's
right.
have a feel of the back now. Just going to have a press of the back, Neil. I don't think we're going to be able to lie down flat.
Okay.
It's going to be the issue.
Lying Neil flat on a stretcher is likely to cause him too much pain.
Because I've given a decent amount of analgesia, but we're very, very tender.
Okay.
How are we going to get him across from the trolley?
A trolley bed would be more comfortable, but couldn't be wheeled through the ploughed field.
We're going to have to carry, probably.
Or carry chair?
We could do a carry chair sitting.
Yeah.
But then moving him or flying him, sitting up is going to be awkward.
Yeah.
Only other thought is we walk to the helicopter.
No. Shall we try that, Neil? Walk you to the heli?
Getting patients with traumatic head injuries up onto their feet is usually avoided. But in certain circumstances, it's the best option.
All right, Neil, let's just stand you up and see what you like on your feet. Because if we are going to walk you, we can walk you to the scoop. All right, Neil. Now, I know this arm's a sore one, but I'll just give you a little bit of support by grabbing your trousers. Let's go, nice and slow. Good lad. That's the one. Gotcha. Giving you some medicine that's going to make your blood pressure drop a bit. Just take it nice and steady. Let's just get you laying down here then, because that's the way we're going to transport you. Neil?
Things we used to do and don't.
We're going to lie you down onto the scoop and then take you back nice and slow, all right?
No.
We've got you, I promise.
No, I'm going to fall.
No, you won't. You won't.
Time of incident is RTC involving one vehicle moving approximately 25 miles per hour, striking a 6-year-old male. Received so far.
In Tiverdale, Kerry and Tom have been called to a 6-year-old boy who has been hit by a car and is reported as being in cardiac arrest. An ambulance has just arrived on scene and radios into control.
God. I was all geared up then. Right.
Roger, that's the D, thank you. I will stand down the second crew for now. We'll leave Dylan and the medics running over.
Thankfully, the boy is breathing, but his injuries could still be life-threatening. Arriving at the scene of the accident,
Take the red bag just in case, yeah. I don't think we need it, but we never know.
the team find the boy has been moved onto the ambulance.
Hello, mate. How are we doing? Hello, are you Mum? Yeah. Hello. My name's Kerry. Nice to meet you. What's happened? You tell your radio. He went over your leg.
Kyron was walking home from school with his mum when the accident happened right in front of her.
And do you remember everything that happened? Do you remember it happening? Yeah? Were you with him, Mum, when it happened?
Yeah, he literally went across the road and the car was driving down and he's literally bounced off the corner into the lights of the bumper.
Right, okay.
He rolled a few times.
Okay. And now, where's the most pain? Where can you feel the most? In your foot, okay. Is it all right if I have a little look at it for you? Mel, have you found anything obvious?
No, just literally the right ankle injury.
Okay.
No,
you're so brave.
Kyron's right ankle is visibly cut, but Kerry needs to be sure he hasn't sustained any other injuries that are hidden.
Okay. Do you have any pain in your neck at all?
No.
Okay. Can I have a little feel? Is that all right? Okay. Do you have any pain here?
No.
Okay, I bet a little bit further down.
If Kyron was caught by the bumper of the car, he could have damaged vital internal organs, like his liver and spleen.
Does it feel tender here at all? Okay, and what about your tummy? Can I have a little press? Is that all right? Does that hurt? Okay, and how does it feel just here? Does it feel all right in your hips there?
It appears Kyron has escaped any major injuries, but they can't say for sure until he's been checked out in hospital.
Can you pull your foot up like that for me? Fantastic. Well, that's all good, because it does look like isolated ankle, and there's not a lot of swelling there. So I think we've just got a graze to the foot.
Hopefully.
And you're a very, very brave young man, aren't you?
I think I need an X-ray.
Is that what he said?
Obviously in shock, to be honest.
Oh.
Thankfully, Kyron is well enough to be left in the care of the ambulance crew.
Shall I leave it to him? Thank you. All the best then. Nice to meet you. You're a brave boy. All right, you take care. Thanks, Mum.
Kerry and Tom are now released for their next case, and Kyron is safely on his way to hospital. Kerry knows it could have been very different.
Thank the Lord. Scary stuff. And to be so minor, after thinking that he's seriously injured.
Got away quite light, really, isn't it?
Yeah. So when you get there and you see the little boy sitting up, talking to you, shaking your hand, your heart just goes, oh, thank God.
No, you won't.
At a remote farm in Staffordshire, Alistair and Dr. Ali are trying to get 53-year-old Neil onto a scoop stretcher.
Relax back.
He fell from the first floor of a derelict building and has suspected fractures in his back and ribs, which need urgent hospital treatment.
We've got you, I promise. Yeah? Okay, nice and slow.
Got you, that's it. Relax back. Yeah.
All right, there you go. Good lad.
Once on the scoop, Dr. Ali can give him more pain relief.
Yeah, some more painkillers coming in. Well done, buddy. How you doing, Neil? That better now? Good lad.
Among Neil's injuries is a suspected broken rib, which could puncture his lung at any moment.
Do you want to hold that? Sorry. Big lump.
Neil, you okay, buddy? Just open your eyes for us. Good lad, that's fine. Well done.
Now prepped for the journey, Neil can be safely transferred into the helicopter.
So one either end, and we're heading for this side of the helicopter, but at the back.
where we need the feet towards the tail, and he'll go in head first.
Okay.
Okay. Right. Ready, steady, lift.
Bystanders have helpfully dismantled part of the fence to make life easier. But there's still a ploughed field to negotiate.
You okay, Neil? Good lad. Just 2 minutes of this, all right? Coming up to the big rut. Just going over the rut.
Okay. Just nice and steady. Okay. Does anybody need to reposition? Are we happy? Okay. So we're in the rut, hopefully, or on top of it.
Neil is positioned head first into the aircraft, so Dr. Ali can provide critical care en route.
Just again, everybody happy? There's going to be a bit of a lift now.
1, 2, 3.
It's another half a foot. 1, 2, 3, and stop. Perfect.
Lovely.
03 receiving.
Before setting off, Dr. Ali gives the trauma desk another update on Neil's condition.
So we've got a male fallen approximately from first story, landing on left rear chest. Injuries-wise, he's got a head injury to the left occiput, possible chest injuries with maybe a underlying pneumothorax.
All receive, thank you.
Thanks very much. Any changes, we'll give you a bell from the air. You okay, Neil? Give us a thumbs up now. That's the one. Good lad. I know what to look out for now. Very loud and very shaky, okay? All right, Neil, there's going to be a start-up.
Neil's destination is the Royal Stoke University Hospital. By road, the journey would have taken 40 minutes. By air, it's just 15. Here Neil is handed over to the emergency department for urgent scans to discover the full extent of his injuries. As a major trauma centre, all specialists are on hand for any treatment he may need.
Right, Chris, we are clear from the top.
Helimed 03 is now available for the next emergency call.
Ambulance services, patient breathing.
Yes, mate, he's just been knocked off his motorbike, mate.
Okay, is he awake at the moment?
Yeah, he's awake, mate, but he's in a hell of a lot of pain.
How old was the little man?
The young lad, motorbike. He's about 21.
Excellent, thank you. Is it car versus motorbike?
Yeah, pulled out on him, mate, knocked him right up in the air.
Has he moved at all?
He ain't moved, no, he's in a lot of pain, though.
I'll respond going to you as quickly as I can. Alright, we are flying to your blue lights and sirens.
An ambulance has been called to the scene, but as the man's injuries may require specialist treatment, Kerry and Tom are also immediately dispatched.
We've been called to assist a crew who are a motorcyclist who's been hit by a car. I think he's in quite a lot of pain with possibly a femur fracture, and they're wanting a little bit of assistance from us with regards to advanced pain relief to help move him.
The man is reported as being in so much pain, the team may need to give him the strongest painkiller they carry in order to get him to hospital.
It sounds like his leg is buckled underneath him and that they're really struggling to move him or manipulate him with the pain relief that they've already administered. So we'll get there, we'll find out what they've given or sort of supplement it accordingly and try and get him moved on quite quickly.
5 minutes later, Kerry and Tom arrive at the scene of the collision, where the patient is being treated by the crew on the ambulance.
Okay, we're in.
Hi. Yes, thank you. You?
Yeah, thank you.
Good, good. I'm Kerry. This is Tom.
Hello. Right, so this is Mitch. He was driving down this road and a car pulled out in front of him, knocked him off his bike.
23-year-old Mitchell, an air conditioning engineer, was on his way home from work when his motorbike collided with a car.
He's got massive swelling to the leg. We're unable to straighten the leg. We've given him 10 morphine and some gas in it, and still got too much pain to straighten.
Okay, so if we get a blanket on him for now, and we'll have a look, see if we can get a vein. In terms of chest,
Chest is fine, good rise and fall of air, no obvious deformities to the chest.
Not knocked out?
Yeah, not knocked out.
Where I touch it, does it hurt at all?
It's not hurting.
No? How about here, across here?
No, my collarbone's just fine.
Mitchell has an obvious fracture to his femur. The bones are out of alignment, restricting blood supply down his leg. They need to straighten the leg in order to make Mitchell more comfortable and prevent potential permanent damage to his foot.
Okay, sharp scratch then. Can we get the other 10 of your morphine drawn up? When was the last time he had morphine?
6.
So if we give him another 5 at the minute, get Kendrick ready, and we'll get a bit of ketamine on board.
Kerry wants to use a special traction splint known as a Kendrick to straighten Mitchell's leg, but it can be an excruciatingly painful procedure.
No, so your ketamine's in this little pouch over here. There we go. 20ml syringe and a needle. Mitchell, do you know how much you weigh, mate? Kilograms? Just because I'm trying to work out the dose of medication I'm going to give you.
I'm about 17 stone.
That's all right, don't worry. The drug I'm going to give you is called ketamine. You may well have heard of it. Yeah, a lot of people say that. So it means that you'll hopefully not remember. Okay, so as much as it sounds scary that we're going to be pulling at your leg, I'm hoping that if we give you enough just to take you away for a few minutes while we do it, that you won't remember, all right? Okay.
Ketamine is a powerful sedative and painkiller that affects the short-term memory and alters the patient's perception of pain. Trainee Tom draws up the dose ready for a qualified critical care team member to administer it, at the point Mitchell needs maximum pain relief.
If we get the Kendrick ready, I'm going to go and have a word with the family, just because the fact that we're giving ketamine, you might hear some noises.
While Tom prepares the traction splint, Kerry explains the procedure to Mitchell's mum, who arrived on scene not long after the accident.
What we're going to do now is we're going to put some traction on it, okay, which will pull it straight, which will, although it will hurt him, we're going to give him some ketamine. You may well hear him sort of shout, because when we pull it, he won't remember. It's just for a procedural movement. So I just wanted to make sure that if you do hear that, I'm not doing anything terrible.
Okay.
It is just to put in that splint, all right? That's what I've come out to tell you, okay? Are we all right, guys and girls? Are the ondansetron going in?
Yeah.
Lovely. What we'll do, we'll get the groin strap and the ankle strap on. So if we get the vacuum splint off nice and gently.
Mitchell will need an urgent operation. The orthopaedic team are on standby at the hospital. But first, the critical care team need to pull his leg back into the correct alignment. An agonising procedure that usually requires sedation with ketamine.
Mitch, I'm just going to start touching your leg because I'm going to take this splint off. If it hurts too much, just let me know, okay? I'm not going to move your leg at the moment, okay? I'm literally just taking this splint off.
Kerry has the powerful drug on standby. Mitchell will still experience pain, but the effect of the ketamine means he will be less aware of it.
Right, if you just get ready to support.
That's just my hand.
Okay, that's fine. All I'm doing is letting the air out. I'm not going to take the splint out yet. Well done.
That's it. Do you want to go on the gas and air for a minute?
Little of your agency, I'm behind his knee
Mitchell.
as well.
If that hurts too much, I'm just going to give the... Okay, right, let's stop a sec. I was going to try and put it on while now, but what we'll do, we'll give him the ketamine and we'll just do it. There'll be no major rush with it, but we'll do, if you guys can do the groin strap for me and Tom will do the ankle strap.
It's got no robots.
Despite already having been given morphine and Entonox, the slightest movement to Mitchell's leg is unbearable. So Kerry decides the time has come to give the ketamine.
You put the camera on for me.
Fine on there.
As a critical care paramedic, Kerry's the only person authorised to administer the drug.
Right then, Mitchell. I'm going to give you this pain relief now. It's going to make you feel really strange, all right? You won't feel it, hopefully. I'm going to give you enough that you won't feel it. All right? Well, it's kind of like it. There we go, there. Okay.
Once given, the dose has almost an immediate effect.
And if you're happy to drop the side in a sec, I'm going to give the ankle a pull, yeah?
But it doesn't last long, so the team must work quickly.
Okay, that's fine, that's fine, that's fine. Okay. Are you happy with where the groin strap goes and that bit with the two bits on it goes on the outside?
The next step is to attach the Kendrick traction splint.
That's it. Isn't it by the look of it? Tom, are you happy to get next to me and pull the red one as tight as you can?
Mitchell's bones still need aligning. Applying traction with a splint will pull the leg into the correct position.
Okay, ready? Yeah, okay. Is that as far as it'll go? Mitchell, you've done amazing. Okay. Mitchell, you've done amazing. You've done amazing. Okay. The lovely crew that come out to you are going to take you to Russell's Hall and they'll get you sorted, matey. Your mum's outside, I've updated her. Don't worry about anything, all right?
I know you're saying that I've done amazing, yeah?
You have?
Do you want the one that's doing really nice?
Oh.
I appreciate that, thank you.
Oh, bless you, thank you. It's my pleasure, Mitchell. It's nice to meet you. I hope you get well soon.
The whole procedure lasted only 3 minutes. Luckily, Mitchell is unlikely to remember a thing.
Hey, thank you.
You, Mum?
I am.
Do you want to come and see him?
Yeah.
Come on.
For Mitchell's mum, it's a big relief.
And they've probably explained what's going on at the moment, haven't they? So he's a lot more comfortable now. Sort of got on top of his pain with different pain relief and straightening his leg a little bit now, which is good. So he's all wrapped up and you can go say hello.
Okay. You're all right? Don't worry. Not because of the COVID, listen, I'm not allowed to be here. Listen.
As the ambulance crew prepare to take Mitchell to hospital, Kerry updates control.
9-5, thank you. He does have a right wrist injury, which could be a fracture. He's also got some pain in the left humeral head stroke shoulder and right proximal femur fracture, GCS 15, and the crew are happy to convey.
Amazing. Thank you very much, Kerry. I'll let Russell Hall know now.
Thank you.
It's the end of Tom's first shift in the critical care car. And on the journey back to base, there's time for a debrief with Kerry.
I think that was very appropriate allocation of job for this car, really, wasn't it? It was really good that you could bring that advanced skill set in to really help a patient out and subsequently help a crew.
Have you made the right choice by joining our team?
Definitely.